Greetings and very warm welcome today, World Mental Health Day. And so it's with great pleasure that I have the eminent psychiatrist Dr. George Mikellides in the program today. And we're going to discuss in particular teenage suicide. Very disturbing situation, and so we definitely need to discuss this and what the statistics are. Do stay tuned. And that was the English Chamber Orchestra with Mozart's Symphony Number 40 in G minor. A reminder, you're tuned into Rick Classic 88.2. We're coming to you live. We're also streaming on cybc.com.cy. And we are now also live on Facebook from my Facebook page, Saskia Constantinou. A very warm welcome. And the reason is that it's World Mental Health Day today, and I'm very happy to have in the studio with me Dr. George Mikellides, eminent psychiatrist. Very warm welcome.
Good afternoon, Saskia, and thank you for inviting us today to talk about a very crucial topic, and it's very essential to be able to understand how is this actually affecting our society today.
If you just a little bit would make it better. Every 40 seconds, somebody loses their life to suicide, according to the World Health Organization statistics. That's 2,000 people a day worldwide. And even more horrifying is that suicide is the second leading cause of death in people aged 15 to 19. Last month we had the tragic situation of 15-year-old Stylianos being found dead by his father following reports of abject poverty, psychological problems and domestic violence. Cyprus has approximately 36 to 40 suicides a year. There was a peak in 2013 with 45 due to the dire financial circumstances people found themselves in. It's mainly men, but we have no national strategic plan for suicide prevention, which is the focus of today's World Mental Health Day. It's not really surprising that Cyprus also has the second lowest number of psychiatric hospital beds among EU member states. We've had the chief psychiatrist of our only psychiatric hospital, Athalassa Hospital, built in 1964, by the way, which often states the dire need for help, financial and with more medical staff. According to CIPSA, there's no national strategic plan in Cyprus for suicide prevention, although the Ministry of Health's 2018-2020 strategic plan states that prevention programs would focus on children and adolescents. Dr. Mikellides, I'd like to start by saying that although suicidal behavior is a major problem worldwide, it's received relatively little empirical attention. Why is this?
Because there are so many factors that can actually affect someone's mental state, and what we tend to see, some of the suicides which do happen in the context of an impulsive behavior following, for example, a breakup, a financial issue, following different factors that can actually affect your mental state. Some of these suicides are planned, and quite importantly to be aware of that we need to be able to understand this kind of thinking which might lead to a suicide. But a lot of the time, even for clinicians, even for expert psychiatrists, it's not so easy to be able to kind of like foresee a suicide, and so that's why actually do happen. And all the time as well, many of those people, they do either commit suicide or do present with a suicidal attempt. They were not previously in contact with mental health services, which makes things even much more difficult to be able to contain and understand the factors which led in this type of behaviors. And also what we tend to see is that families they are not much of aware, they are not aware of someone's behavior or thoughts until the point that someone actually commits suicide or a suicidal attempt.
A study conducted in 5 culturally diverse countries, Brazil, India, Sri Lanka, Iran and China, to determine the effectiveness of brief intervention for suicide attempters in 2008, concluded that significantly fewer deaths from suicide occurred in that group, concluding that suicide prevention programs are effective, and that suicide is a preventable cause of death.
It could be, but I wouldn't say it's something that can be prevented 100%. So
No.
at least we can reduce the numbers.
Yes.
At least we can try to ensure that someone who is in need of for something and needs help to be able to access the right help. And in regards to mental health services, in regards to be able to see a psychiatrist and be having following up appointments with mental health professionals.
Yes.
So the WHO obviously pointed out that we need to try and work on different factors and different ways, as you have said, to at least reduce the numbers of suicide, which is around 800,000 people per year. As you have said, one person every 40 seconds.
It's terrifying.
Which is terrifying.
I mean, in the subject of our discussion, we've had how many deaths already?
Exactly.
Just while we've been talking. So if
Exactly.
you think that 10 people have killed themselves.
So we do see that, for example, access to means, it's something that we need to think about. And for example, in the UK, and we have seen changes in Cyprus, for example, like selling paracetamol, which is a tablet as an overdose can actually kill someone.
Yes.
And in UK, for example, you are not able to buy 3 packs of paracetamol from Boots or from anywhere else just by one visit. So they try to reduce, in
Yes.
a way, the chances of you having second and third thoughts by having to go in 3 or 4 different pharmacies
Yes,
or
yes.
stores to be able to buy enough amount of paracetamol and to kill yourself. And in Cyprus, what we see now, which is a good way of preventing in terms of access to paracetamol, you can buy them obviously from a pharmacy, but you cannot buy them from a shop or a supermarket, which is a good thing.
The statistics show that 85% of deaths occur in low and middle income countries.
That's right.
Why is that?
I suppose is again thinking about perhaps in those countries access to mental health services is limited, or sometimes not even existing. In some African countries, for example, there are countries with very few psychiatrists as a whole. We're talking about countries that they have a huge population and there is no psychiatrists, or there are few psychiatrists in those countries. So if you're not able to access help, then obviously you're at higher risk of committing suicide. Access to help, I think, is very essential in those regards. And also is to think about poverty and financial situation. If you're not able to access the basic needs for you to survive, and I'm referring, for example, having a roof above your head or food, and if your life is so difficult day in, day out, and you're suffering through other issues as well, which could be physical health problems, it could be chronic pain, it could be difficulties, for example, in families, then all these are actually adding up, and it feels that you're at risk basically of doing something as such.
We've discussed suicides, but the stats for attempted suicide are even more
higher.
Alarming, as published by Acta Psychiatrica Scandinavica in a research done by Hult and Wasserman et al., who state that attempted suicide is 40 times higher than
the actual suicide.
the actually completed suicide. Yes,
that's right. And obviously And another essential thing to mention, we've got the statistics, but I'm wondering sometimes as well how real these statistics are. As we can see that in Cyprus or Greece we have low numbers of suicides if it's to be compared with the rest of EU or the rest of the world.
Yes.
But I'm not sure if all the suicides actually are counted.
That brings us, because there's a certain stigma attached to suicide. From the church, in the case of Cyprus, from
society,
from insurance companies who don't actually pay out if somebody commits suicide. I want to move to teenagers because I think that that is somehow particularly awful, and the stats are horrifying. Attempted suicide is said to be the best predictor of future suicide. So it seems, as you said, that the follow-up and the aftercare is vital if we need to reduce these numbers. What do you believe is the best way for somebody to be able to do that? And I guess that we're directing the answer primarily at parents. To say, don't take it lightly if
That's
your
right.
child has attempted suicide.
That's right. And
or is even talking about it.
And then again, it's a stigma here. And sometimes if someone does attempt suicide, there might be a need of hospitalization. And sometimes there is a need of formal admission. That means like sectioning or going through the court procedures.
Yes.
Which could be a lot of stigma attached in a society as small as the one we have here in Cyprus. And on the other hand, it could be, as been said by patients or families, as we see from first-hand experiences, that it's very traumatizing for the patient and for their family to be sometimes handcuffed by police officers, to be taken to a hospital.
Handcuffed?
I mean, obviously, if they are aggressive towards themselves or others, the police officers might use these means to restrain someone for their own safety in those regards.
Okay.
But obviously, then there is the issue there again that this is a patient, this is not a criminal that needs to be handcuffed, obviously.
Yes. Surely there's some other ways. Is that something that's done internationally?
Sometimes it does happen. Sometimes it does happen that the police uses any ways of restraining someone, and I've seen it happening. And obviously the police, I've seen it happening in the UK, I've seen it happening in Cyprus, but it's very difficult. And if someone starts to hit their, like, let's say their head on the wall or start punching police officers, then obviously there is not much that they can do. And I don't criticize them badly, because I can see that it's very difficult to contain someone, especially that these people might be without medications for some time. Some of them, they might be experiencing psychosis as well.
Yes.
So they might hearing voices. So obviously until they get to hospital, the police might use different ways of restraining them.
Okay.
No, it's not ideal. No one will say it's ideal, but sometimes it's the necessity that needs to happen to be able to take someone to a safe place.
Right. The Brain and Behavior published a study that's still being conducted where cell phones, and I thought this was absolutely fascinating, of about 50 teenagers are being tracked in New York and Pennsylvania. And it will probably make most teenagers cringe to be tracked. But they've all agreed, with their parents' support, to capture every detail and nuance that a doctor cannot ask and can't follow. So things like their text messages, the tone in their voice, their facial expression in selfies, how much music they stream, and all this information is being put into a server. These are all teenagers who've attempted suicide and have been diagnosed with depression. It's all part of MAP's mobile assessment for the prediction of suicide. And I wondered, is Cyprus part of any such study, or has anybody thought of doing such a study?
I'm not aware of any ongoing study in the the topics you've just mentioned, and perhaps there is a huge amount that can be studied and a lot of data that should be collected, but we might be facing different kind of like fences on the way to collect this data. It could be that there might be the necessity to collaborate with the police, for example, with forensic units, also with different hospitals, private ones, public hospitals. So a lot of the time that to be able to get into collecting this data is not an easy work. For example, in some other countries there are like have a way of registering, let's say, suicides and all these deaths that happen due to reasons that are investigated by other coroner's court. And obviously if a suicide is investigated by a coroner's court, then there is easy to be able to collect this data. But what we tend to see a lot of the time in Cyprus, that some of those suicides might just even the family don't even talk to I don't know, let's say relatives about the suicide. They might have said that, oh, we have found this person dead, and maybe it was just his heart, and they bury him next day without even investigating further the cause of death. So it needs to bring awareness. We need to think about as a collective and as a multi-agency to be able to start collecting those data, to be able to understand more these suicidal behaviors and these suicidal attempts that do happen in Cyprus. Probably we will find quite common grounds with suicides and suicidal attempts that happen elsewhere in the world. But unless we study and research the area in Cyprus, then we are just basing our information on literature, that studies that are done elsewhere.
I think one of the most concerning factors is something that Dr. Samartzis has brought up, and I'm still in shock a month later to hear that he's one of two, for example, on drug and alcohol dependence, which of course leads to extensive depression, and then you're open to commit suicide. I mean, we don't have mental health services.
I think it's quite clearly said many times by doctors in the public or even the private sector that the public sector is quite understaffed in terms of doctors, in terms of psychiatrists, in terms of clinicians. So it's very hard to think that if you're trying to do, let's say, a 9 to 5 or a 7:30 to 3 job, as it stands in Cyprus, and you're doing a full clinic 5 days a week, there is no time to do research. There is no time to do, let's say, audits and things as how to develop. I mean, in the UK, there is time to do quality improvement projects. There is time to do auditing of your own work, of auditing of other doctors' work, also doing research. And if there is no time and you're doing a full time job, 7:30 to 3, and there is no time for anything else, then how can we improve our services? And if you're understaffed on everything else, there is no time for personal development, there is no time for professional development. So it's very tough, actually, to say.
And in addition to that, he's also extremely pressured. He said, to see as many patients as he can as possible. And then, obviously, and he, by his own admission, he said then the level goes down. He doesn't spend the amount of time that he wants to.
That's right.
On one particular patient. I mean, maybe somebody comes in and they're really not okay and they need 3 hours of his time.
You don't even have half an hour, so how are you going to have 3 hours? And especially for, like, let's say, psychiatric patients, it's not as easy as, like, you broke your leg or I can see a fracture, let's fix it. You need to go and understand the whole biopsychosocial model. You need to understand the biological aspect of things. You need to understand that someone is suffering from depression. Then obviously there is medication. Then there is psychology that you need to advise the patient to receive psychotherapy. And then the social aspect, and how is he doing financially? How is he doing with his wife? How is he doing with his children? It is so multidimensional, the work of a psychiatrist does. So it's not as straightforward as another clinician or a doctor that will say, okay, your bloods are fine, off you go, there is nothing wrong with you. It's not as simple as that.
What are your thoughts on the hypothesis that imitative behavior may have a role in suicide amongst teenagers?
Yeah, like copycats, as they say sometimes.
Yeah. Films, TV, YouTube,
Yeah.
peer pressure.
And obviously there are a lot of, as you have said, there is a lot to do with bullying, there is a lot to do with peer pressure, there is a lot to do with if your situation at home is not as good as it could be, then there are other factors that are going to influence you much more. And if you don't have trust or care from your parents, from your siblings, and you're experiencing a very chaotic home and very difficult life in your own home, then you might try to seek support from peers, from other people, and some of these people might actually not be the great role models as well. So as we have seen like a few months ago, we could have seen that different people, they were advising teenagers, or there are different kind of tasks to complete in order to climb the iceberg and kill yourself, as we have seen, let's say, previously in other countries. So there are so many factors that come into play, but what we need to try and see for a teenager or for an adult, and how good and how safe is the environment that he's living in.
What constitutes a bad environment?
So what we tend to see sometimes, and we tend to see mental health problems developing, is sometimes we see in families as so-called highly expressed emotions. So enmeshed families that...
Sorry?
Enmeshed families that...
Enmeshed, yes.
So they're very kind of like, there are no boundaries, basically. So a family where a father or a mother figure is kind of like suppressing a teenager or suppressing someone in the family,
yes,
or becomes, let's say, verbally abusive, physically abusive, or any other type of abuse. And neglect is also a type of abuse, actually not caring for someone, not giving enough attention. And a lot of the time...
Not enough attention.
That's right. Obviously, overprotection is not good as well. So
yes,
it's all about boundaries, and it's all about, let's say, as the ancient Greeks used to say, everything in moderation, basically.
As I want to focus a little bit on not enough attention. I think that many parents think that picking up your child, taking them to, and I'm speaking particularly about teenagers now, taking them to their extra lessons, come home, have food on the table, but not actually speak to them. Not actually converse with them.
Exactly, lack of communication.
It doesn't mean that they haven't got everything there that they need. The child has their mobile phone. They have, all the material things. It isn't sufficient, is it?
Absolutely not. And as you have pointed out by discussing this, is there is a huge lack of communication between family members. And a lot of the time parents don't even talk between them, or don't talk to their children. Like a simple question, how was your day today? How was school? What did you do in school today? Do you have to study? Do you have homework? And how are you doing with your private lessons? Are you enjoying going for piano? Are you enjoying going for tennis? Obviously, doing things for the sake of doing them, or because the father or mother in a relationship at home is advising their children to take on, is not great. You need to actually reflect upon your children's behavior and be able to understand and find out if they do enjoy the activities you're proposing. If they do enjoy the activities you're actually saying, oh, you need to do English lessons, you need to do French, you need to learn Russian. Do you enjoy doing those things? You might not.
How, because from the side of the parent, you may also have a rebellious teenager, or someone who doesn't want to follow the parameters that parents have set. Which obviously, and peer pressure can lead to other types of problems.
Drugs.
How does one find the balance? There isn't, I keep saying there's no university for being a parent.
That's right.
How does one find the balance, and what are the signs that should trigger off some kind of alarm bells that maybe you need to have a look and check without infiltrating and being, them feeling that you're nosing into their private matters. So How does one set those boundaries?
Sometimes what we tend to think, for example, it's all about setting boundaries, and it's all about thinking what's the best way to support a child. A famous British pediatrician and psychoanalyst, Dr. Winnicott, have mentioned long time ago about the term "good enough mother."
Yes.
So we don't need to be kind of like excellent in parenting. What we need to be is just good enough. And you cannot quantify what actually that means.
Yes.
But what we tend to see is all about bonding between parents and their children.
Yes.
It's all about attachment and how you can achieve a certain amount of good communication between yourself and your child. So you need to be aware that a child might experience different triggers, different types of problems growing up, which could be due to becoming a teenager and the hormonal changes and everything. So you need to start by listening what the child has to say.
I think
right?
that often parents don't listen enough. We tend just to put our own thoughts across.
That's right. So what's important is just start by listening,
yes.
Understand why the child is behaving this way. There might be bullying, there might be issues in his own kind of development, and sometimes we tend to see like in children, obviously I'm not a child psychiatrist, I'm a general psychiatrist, but going through my training, I did child psychiatry in the UK, so I'm referring to those type of experiences I had with children. What's important is to try and focus on your own child and be able to identify different issues that might arise at different times. For example, sometimes we can see a child bedwetting longer than it should, and it could be problems with sleep, it could be problems as referred as pain, it could be avoiding to go to school. Those are alarming kind of bells that we need to take into consideration and trying to dig into understanding why these things are there. And it's not just, it has to be a neurological cause. No, a lot of the times a psychological cause. You need to be able to point that out, and perhaps the child might need psychotherapy. The child might need to see a professional, and not just to avoid taking your child to an expert, because you might say, he's only 10, he's only 6, he's only 7, he's only 12. They're going to start him on medications. If the issues, if the health problems don't actually have the right care, these problems could increase and could be much more difficult to actually treat them on a later stage when actually the big boom happened.
When the big boom does happen, the parents, the siblings are left behind.
Yeah, and obviously at times we can see siblings getting from like a clinical history that they felt neglected because one child had more issues to do with his health, so the other 1 or 2 children didn't actually receive enough attention from their parents. We see sometimes mothers with postnatal depression, that they didn't actually receive treatment for their depression because of the A, B or C reason, or because of the stigma. Obviously that's going to affect the relationship between the mother and the child, and we can see a lot of mental health problems rising from mothers having postnatal depression and the treatment didn't take place on time, or there were difficulties between communication between the mother and the child. So if something does happen, if it's to do with the mother, with the father, with the child, they need to actually receive proper care.
In this case, I understand, obviously you're the psychiatrist, but the people that they see prior to that are the doctors.
That's right.
Do you feel that doctors are sufficiently educated on the subject of mental health as well, so that they can put their fingers on it and possibly say, you need to go and see somebody before? Or do you think that they're too focused on physical ailments?
Yeah, obviously I'm not here to judge other people.
No, I'm speaking generally.
What I can say is that we can see a generation shifting of clinicians that they take mental health problems much more seriously these days than they used to 20 or 30 years ago. But unfortunately, what we tend to see a lot of the time is that stigma, as we did describe earlier, is among clinicians and doctors and everyone in this society we're actually living. And I'm referring not just this society in Cyprus, but in societies in general. I mean, we've seen like people saying, I've seen posts of people on Facebook, I had first-hand experience from patients saying, doctor, you know, I went to my GP and the GP said, oh, what, am I going to send you to a psychiatrist? Do you think that the psychiatrist is going to help you? Do you want the psychiatrist to just say you're crazy? I mean, those words sometimes even come from doctors, which is
very shocking.
That's very shocking. That's very disappointing as well. But what's important is, and we need to think that things are changing, and which is great. And we can see in different specialties, especially for the GP training in different countries, in Cyprus including now, we can see that happening, that GP trainees or general doctors trainees, as part of their training, they do a few months of psychiatry. So at least they can have a first-hand experience how it is and how real is a mental disorder and a mental illness.
Are there enough seminars to discuss all these mental health issues, and are Cyprus doctors, from doctors to specialists such as yourself who are psychiatrists, able to go? I'm just thinking, how, for example, is Dr. Mikellides, who's in the government sector, going to be able to go when he's got so many patients?
Exactly.
There are two of them there dealing with 30,000 people who need his help.
Exactly. I mean, it's all about professional development and continuous personal development, which is essential in such a field of medicine in which we can see things evolving and things changing for the better, I hope. So what's important is to try and identify and understand the need of continuous personal development in an area such as health and medicine. Otherwise, you will be just stuck as what you have learned through, let's say, university and through your training, and perhaps through your own time that you might need to spend reading journals, reading articles, going to conferences around the world. But what's important is we need to pay enough attention to continuous personal development in doctors to be able, not just, as you have mentioned, psychiatrists, but other clinicians. If a patient goes to gastroenterologist and they are complaining of a stomach pain and they do get investigated for everything and there is nothing there, they should be referred to see a psychiatrist. They should not just say, take this and you'll be fine. Because the specialty that treats, for example, somatoform disorders or psychosomatic pain is a psychiatrist, no one else.
Yes.
So they should see the specialist.
Yes.
As for example, if you have an issue with your lung, you're going to see the lung specialist.
Yes. Post-traumatic stress disorder. Female sexual assault survivors have come to the fore, especially with the Me Too movement. Do you feel that they have enough help, or are they facing the stigma again? And how do we break down these barriers?
Yeah.
I'm thinking the church in Cyprus doesn't bury victims of suicide, and I call them victims because they're victims.
That's right.
I can't imagine to get to a stage where you actually do it. Many people have thoughts, but to get to the actual stage where you do it, and then the trauma for the family to be told you've committed a sin and you can't have any rights.
I mean, it's very important. There are many issues to address, and we need the cooperation of everyone, the church, the Ministry of Health, also private and public health sector, doctors, clinicians, health professionals, to be able to actually help in those situations. And we cannot, let's say as psychiatrists, we cannot force the church, we cannot force someone to do what we consider right. And as you have said, it's very essential to start thinking about victims of suicide rather than just of someone who actually is a sinner. So,
I mean, there's a whole repercussion. I would think that the entire family balance has been devastated. For example, in this latest case with Stylianos, we have seen that the family has completely disintegrated. Children have actually been removed from the home. So these are situations which do occur.
That's right. And you pointed very clearly that it's not just the victim of someone actually committing suicide, but it's who is actually left behind to cope with the aftermath of a suicide. And
are there statistics that show that those people left behind are become even more vulnerable?
Obviously, they are at risk of developing depression, anxiety disorders, sometimes PTSD, especially if someone commits suicide in front of your eyes, which it does happen sometimes. And people might suffer from flashbacks, they might suffer from nightmares, which is very tough, and they should be getting the right help as well from mental health professionals. I mean, what's important is to try and address all these issues at the right time, because if those symptoms persist longer than they should, then things will become much more difficult, and it's going to affect your social life, it's going to affect your physical health. I mean, we see people suffering from chronic depression or anxiety left untreated. They start to develop heart issues, they start to develop high blood pressure, diabetes. So it's very important to address your health. It's to do with your mental health, it's to do with your physical health. Sometimes we need to think as a whole. We've got a human being in front of us. It's not just physical or mental health. We need to have a holistic approach.
The fact that you said that people kill themselves in front of others makes me also think of accident victims. We have terrible statistics of death on the road, and every time someone dies on the road, there's somebody else usually there who's actually
it's a witness of the event.
A witness of the event. Media have a very important role, I think, in how they report. Yesterday it was reported that somebody had, and I quote, a nervous breakdown, having actually killed somebody else on the road. What happens in these situations, Dr. Mikellides? Do they actually get help?
So I suppose in Cyprus or in most of the countries around the world, you can seek help yourself through the public or private sector. What's important as well is the families have an essential role, even if we're referring to teenagers or even if we're referring to adults, because a lot of the time some of those adults, they don't want to get help, or they think that they will sort everything out themselves, which is not as simple as that.
What is the sign when you realize that you're not coping, you're in deep depression?
So it's all to do with your functioning in a way. I mean, what we tend to see most of our patients that they come to our practice is that they have difficulties with work, they have difficulties with relationships, they have difficulties concentrating, sleeping, eating, all those like biological symptoms of depression are quite there. They're not. You cannot hide that you're not able to sleep, and you slept for 3 hours last night, slept for 2. I mean, that's actually affecting you. You might start to become more grumpy, let's say, about everything and anything.
Yes.
So, and they're quite like very clear for someone that there are signs and symptoms there that need to be addressed by the right professionals. I mean, those signs and symptoms can be seen by the same person that is actually suffering, or by relatives or flatmates or friends. I mean, if you've got a friend and you're asking the person to go and grab a coffee as you do for the last 10 years, and they start having excuses, I don't want to go out this week, I don't want to go out next week, I just want to stay at home. You can see that something is not right. So you should just step in and say, okay, are you right? Is there anything I can do? What's going on? Ask simple, open questions. You don't need to start picking on like all those close questions. What's wrong with you? And sometimes it's not what we say, but as everyone says, how we say that. And one thing is to show that you're caring, and the other is just showing that you're curious about it, which sometimes it could be both, or sometimes just one of the two when it sounds quite horrible, when you're just curious about something and you're not actually caring or wanting to actually help the person.
How much of a risk indicator are inherited mental health issues?
Obviously, for different disorders, there are different statistics and there are different, let's say, percentages. For example, in schizophrenia, some people talk about 10 to 15% of a chance of getting schizophrenia if your father or one of your parents have schizophrenia. But a simple example, just to demonstrate that it's not just the genes, it's also environmental factors, it's epigenetics, basically, what happens to your DNA as you go through traumatic events. It's multifactorial in a way to develop a mental health problem. Sometimes you might have it's like a Russian bullet in a gun, and you're just basically shooting the trigger until the gun explodes. So there are different factors that can affect. For example, in twin studies, which were done in identical twins, there was a chance of developing schizophrenia if one of the two has schizophrenia, which was around 50%. So even if they had the same 100% DNA as the same, the chance of developing schizophrenia if one does have schizophrenia was 50%. So it's genes, is environmental factors, and obviously to do with different biopsychosocial factors which can affect someone's mental and physical health.
I want to talk about our society. We're very angry. I think generally here there are some obviously who are more angry than others, but we see situations of road rage, and maybe it's that it comes to the fore more in Cyprus because we're a smaller society, so we hear about it more. How do you think we can start to prevent these outbursts that people have, others are witness to, feelings of humiliating other people, and that occurs also in the schools.
That's right.
Bullying. Bullying is not something, I think it's something that, correct me if I'm wrong, maybe we used to think of it as something being done to children.
No, I mean,
when they
you
were
can
young.
experience bullying everywhere, at work, universities.
It's really everywhere.
So, I mean, we see cases of bullying everywhere, in adults, at work. Your boss is bullying you, your colleague is bullying you. So what it's important is to be able to understand what is actually happening today in our society. And referring to society in Cyprus, obviously we're a small society, so something that's happening in Larnaca and next day the whole of Cyprus is talking about it on Facebook and other social medias. I think what's important is to say that society and human behavior over time is a reflection. And it's a reflection of your growing up times, a reflection how you were treated by your parents.
Right.
It's a reflection how you were treated in relationships, intimate relationships, in friendships. So we develop the so-called personality, which is a characteristic, is a group of characteristics that make us who we are. It's like a makeup of our internal world, our world of thinking and feeling and behaving, let's say. And some of these people, they might have personality traits of antisocial characteristics, let's say, so they might commit crimes. They might have borderline personality traits or even the disorder sometimes. And they actually present with difficult behaviors. They present with challenging behaviors because a lot of the time they're experiencing an intense internal anxiety and they don't know how to control those feelings, and they're quite tough to contain them. If you do suffer from a personality disorder let's say. The treatment is not as straightforward as it's for other mental disorders. It might need a chronic psychotherapy for months or years sometimes, medications. But what we tend to see, people that they do suffer from personality disorders, they might not seek help, or even if they do, they might drop out after a few sessions. 50% are the statistics of dropping out from therapy in people with personality disorders, because the emotions, the feelings, the thoughts that they do experience are quite hard to contain.
I want to go finally to RTMS. How effective is it in treating depression?
So for RTMS, there's some statistics that reach up to 70% of people they might benefit from in depression. There are different studies to illustrate that. So 7 out of 10 people, they might nearly experience improvement of their mental state, of their depression, and some they will go into full remission as well. So as we do talk about RTMS, sometimes as it's licensed for treatment-resistant depression, so usually for people that at least they have tried one antidepressant and they were not helped. The RTMS can also be used, and that's my opinion as well, it can be used as a first-line treatment for people that they don't want to start medications and they don't want to experience side effects, the usual side effects from antidepressants. As we're aware, the usual classic side effects are like dry mouth, weight gaining, sexual side effects, gastroenterological symptoms like stomach upset, diarrhea, constipation, etc. So you don't get all
We
this.
still need to develop a perfect pill.
Yeah, we need to.
Because with those kind of side effects, that's enough to make anybody even more depressed.
Yeah, I mean, to be fair enough, on antidepressants, they're quite effective 65 to 70% of the time as well, where placebo is around 30%. So it's a bit more than twice the placebo effect that we do see from antidepressants. And to be fair as well, most of the symptoms, they tend to wear off after a few weeks. Sometimes after a few days, but some of them they might persist, and the psychiatrists they might need to try another antidepressant to be able either to help with depression or to actually help with the side effects that they were not tolerated. I
think this is what's great about RTMS. Actually, you don't need medication. Maybe you just want to go very briefly, because it's some time since we spoke about the benefits.
You need at least 20 sessions of RTMS. The minimum to have an effect is 20 sessions. Usually it's 20 to 30 sessions, done with 4 to 6 weeks most of the time. I think it's a treatment option that people are considering more and more, not in Cyprus, but we see that in the UK as well. We start to see London clinics developing, offering RTMS, mostly privately.
Yes.
The cost obviously is much higher in UK or in States if it's to be compared with Cyprus.
This is what I also wanted to say. Often people who have psychiatric, who need psychiatric help and counseling guidance, however we want to put it, if we want to take away the stigma of, your title. It's funny, you work 12,
12,
15
14,
years,
15 years. Yeah, you're right.
to study, and then you want to say, don't
sometimes
call me.
No, actually,
psychiatrist.
I'm quite proud of my title, and I'm proud to be a psychiatrist. But you're absolutely right. Sometimes family comes around and actually say, can you hide your title of being a psychiatrist? Can you hide your professional cards? Or I don't know, can you hide your signs? And obviously that's a bit ridiculous. But sometimes they feel that they are having hard times to get their relatives to see a psychiatrist.
Yes. When they do, are all psychiatrists then now part of YESI? How does it work from a financial perspective? Because unfortunately that's also one of the issues.
Mm-hmm. So I suppose some are part of YESI, some psychiatrists, or in any other specialty we see that there are still doctors that they're practicing in YESI or out of YESI. I think that there are stuff to be done for people to be able to join ESC as doctors or as psychiatrists.
Yes.
I even, for example, mentioning now, I pointed out some questions to ESC like a month ago.
Yes.
Considering maybe to be a part of ESC.
Yes.
They haven't answered yet. A month has gone.
Right. Well, they don't come here either to discuss on this program.
So, I mean, that's the efficiency sometimes, that you're waiting for an answer
Yes.
for a month. And I called them up 3 times.
Ridiculous.
And they have said, we have sent reminders to the people they're supposed to answer. We're just waiting for them to answer. So I said, is there a time frame that I should be expecting some answers to my questions? And they said, we don't have a time frame. So that could be like 6 months or a year down the line, I said. And they said, no, it wouldn't be that much. That's their answer.
All right. Well,
so, I mean,
we'll have to call you again by November to see if you're...
That's very disappointing,
yes.
actually.
Very. What isn't disappointing is that you've been here and you've helped to clarify many issues about mental health. What would you like to leave as a parting message, Dr. Mikellides, especially on today's special day and the fact that the WHO is addressing suicide prevention?
So I think 2 words are essential. Get help. And just don't try and hide mental health issues. Don't try and hide physical health problems, because things can get worse. And sometimes if you don't address things on time, it might be much, much harder to treat anything, basically. Even if it's to do with psychosis, it might be too late to address issues if someone is considering suicide, if you don't get the right help on time. So just 2 words bearing in mind: get help, and get help from the right professionals. Don't try to go to your GP if you're experiencing a severe mental health issue. I mean, GPs can help sometimes with mild to moderate depression.
Yes.
They might provide them with an antidepressant. But the risk assessment is essential to be done by psychiatrists, and to identify risk factors, to identify things that they can be helped by.
Thank you so much for being here. I know you're on a very busy day.
I thank you, Saskia, for inviting me.
Dr. George Mikellides, and there, as you said it, I think we have to create a hashtag get help. A reminder, you're tuned into Red Classic, 88.2, 26 minutes past 1, and we're going to go to music I said was very balancing, and that's Bach, the Suite No. 3 for orchestra.